Hello students, welcome to formulation series. We'll try to learn one shloka per day, that is one formulation per day. Okay, so today's formulation is Chiruvilwadi kashaya. The reference for Chiruvilwadi kashaya is Sahasra Yogam Kashaya Prakaranam. Okay, so let's dive into the shloka. Try to learn the shloka along with me. Okay, Chiruvilva Punarnava Vahni Abhaya Kananagara Saindava Pakvajalam Gudakila Bagandara Gulmaharam Jataragni Vivardanam Ashu Nranam. Okay, read it again. Chiruvilva Punarnava Vahni Abhaya Kananagara Saindava Pakvajalam Gudakila Bagandara Gulmaharam Jataragni Vivardanam Ashu Nranam. Okay, it has totally 7 ingredients and for its utility, pharmacological utility. Okay, so the ingredients are if you can't memorize the full shloka, try to keep some small tricks and try to learn the shloka. When you revise it again and again, it will be easy for you. So the trick is write CP wax next to it. Okay, so there are totally 7 ingredients. Okay, so CP, C for Chiruvilva, P for Punarnava, V Vahni, A Abhaya, K Kana, and S is Nagara is Shunti, we all know, and S is for Saindavam. Okay, in this Vahni is actually Chitrakam and Kana is Pipali, you all know that. Okay, so just write CP VA KSS. If you are prescribing a medication, you should know the formulation. Okay, so Chiruvilva Punarnava Vahni Abhaya Kananagara Saindava Pakva Jalam. These are the ingredients. Okay, and for the pharmacological utility, we write it as GB and GJ. It is a little bit rhyming only. So GB, GJ. Gudakila Bagandara Gulmaharam Jataragni Vivardhanam. Okay, so there are 7 ingredients: Chiruvilva Punarnava Vahni Abhaya Kananagara Saindava Pakvajalam. And the indications are Gudakila Bagandara Gulmaharam Jataragni Vivardhanam Ashu Nranam. Okay, I hope you have understood it. Now let's dive into its utility. So what were the things we were seeing? We were seeing that it can be given in four items. So let's just decode it. Why is Chiruvilva used? Chiruvilva is used as anti-inflammatory, Pachanam and Dropanam of wounds. Okay, you should not, you don't have to mug up these items. Just for a clinical utility, I am explaining it. Okay, Chiruvilva in market you can find pyloride ointment and laxinol syrup. Okay, pyloride ointments are there and laxinol capsules are there. Okay, so pyloride ointment as an external application, it has wound healing properties, and for laxinol capsule, it has anulomana property and it is used generally for constipation. So we can give it in this condition for arshas. Okay, so generally if Chiruvilvadi kashayam is given, you should have a common topic that it is given in arshas, that too in which kind of piles, non-hemorrhoidal arshas we are giving the Chiruvilvadi kashayam. So we know that there is bleeding hemorrhoids and non-bleeding hemorrhoids. In bleeding hemorrhoids there will be rakta pitta predominant, and in non-healing hemorrhoids it is vata kapha predominant. So this formulation is generally Vata Kafahara in nature. Okay, we know that Chiruvilva has all these kinds of properties, and then we have Abhaya in this. What is Abhaya? Abhaya is Haritaki. So Abhaya will act as an best anulomanam for this formulation. Okay, so it can be given in constipation condition, and this formulation has Punarnava has Shofagna property. We know that in case of fissure, and a wound will erupt, and due to the passage of hard stools, the wound will get disturbed and there will be inflammation over that region. For that condition, Punarnava will work as a special ingredient. Okay, and there is Chitrakam. We know that Chitrakam is a better Agni Deepana Dravya. So we can that is the reason the shloka contains Jatara Agni Vivardhanam. Okay, so in this case it acts as an Agni Deepanam also. And this has Pipali is Kana is Pipali acts as a Rasayana property, so it is in here, and it has Shunti. you have to keep it in mind. Shunti has if a dravya in any formulations, if you see that there will be shunti. If shunti is there, means shunti has a property that it enhances the properties of other drugs in which it has been added. Okay, if generally you are giving any aushadhi, example, if you are prescribing a medicine ashwagandha for any strength, or a balyam, or anything that, or any brahmanam in nature, you just add 125 mg, or yeah, or 255 mg, 1 or 2 pinches of shunti in it. It further enhances the property of ashwagandha in it. So that is the reason shunti has been added into it. Okay, and it also has saindavam. You know why saindavam is used? Saindavam is best used for gulmam. Okay, so now we understand what are the properties in it, and in which way we are giving it. Okay, so general idea, and again we have CP, we means we had a shloka in it. So Chiruvilva, it has best anti-inflammatory property and all, and it is used for wound healing property, and it acts as pachanam. And we have abhaya in it for anulomana property. It has punarnava, which acts as shofagnam. It has chitrakam, which acts as agni deepanam. It has pipali, which has rasayana property, and it has saindavam, which is best for gulmam, and it has shunti, which further enhances the property of other drugs contained in it. So general idea, Chiruvilwadi kashayam is used in piles, fissure, fistula, and in general gastric related problems. Okay, I hope you have some idea. This is a small slide to let you remember the things. So it is used for non-bleeding hemorrhoids. So we are using in it vata kapha arshas. Okay, and it is used in fistula in ano, chronic constipation, and acid peptic disorders. It has vata kaphahara property, shofagna property because of punarnava, keela nashanam. Keela in here means arshas is known as keela, so it acts as keela nashanam. It has anulomana property due to abhaya. It is it is also effective in benign prostatic hypertrophy, because in that prostate gland becomes enlarged, so we can consider it as a shofam, and we can give in it. And in endometriosis, it happens due to vata kapha predominance also. So to remove that, also we can give Chiruvilwadi kashayam. And we can also give in colorectal cancer and anal cancer, because it has rasayana property because of pipali, so we can also use in these conditions also. Okay, so once more I'll let you remember it again. What is the shloka? Chiruvilva punarnava vahni abhaya kananagara saindava pakvajala gudakila bagandara gulmaharam jataragni vivardanam ashu nrinam. Okay, I hope you understood the shloka. Try to remember it, and that's all for today. Thank you.